This is building the infrastructure. So it's like, how do we go about if we want to start IPS in Hawaii? What do we need to do to think about doing that? And so go ahead. So we've already talked about this quite a bit since you've been in here with me all day. But leadership matters, so getting buy-in from leaders. And this is, again, typically, so what is your public mental health system like here? I mean, do you have separate agencies that are like, that you would identify or know who they are?
Several parts of Department of Health.
Yeah,
right?
it all falls under the Department of Health.
Okay.
It's separated to adult, child, and then the alcohol and it's like a separate department.
Okay.
too.
Okay.
Mental disabilities division.
Yeah.
Okay. So
Yeah.
you got help. Yeah.
Yeah, no, just filling in just in
Yeah.
case. Sorry, you
That's
got caught
okay.
up. Yes,
That's okay. That's okay. Everybody needs some words. So tell me again, so can you identify, I mean, would you be able to name, like I said, my agency was LifeWorks Northwest. Do you have something that you know is like a public mental health agency that serves, I don't know, a couple hundred people, adults and kids? And
Care Hawaii, looks for them. They also do like the crisis calls, correct? That's really the only one I can think of.
They're part of Department of Health, right?
Yes,
Huh.
they're like a provider agency, but yeah, they also touch on the mental health side, in addition to the DD.
okay. Who runs clubhouses? Is that just independent, or the clubhouses independent?
That's Department of Health.
Okay, so they're through the Department of Health, and they do some employment in clubhouses. Yeah, I was told somebody would be here from clubhouses, but I don't know who would it be.
My first session today, there was someone from the Kaneohe Clubhouse.
Okay. So they do, and typically they serve people with mental health conditions at clubhouses. Okay. Okay. So I'm just curious who else that would be. There've got to be other ones here, I would think, that would be like larger behavioral health clinics. But anyway, so what you want is leadership from them or from clubhouses or somebody that's serving people with mental health conditions. That, you know, they decide that, you know, implementing employment's an important part of what they do. And then what you need to do is hire IPS specialists. And the key to this, and Teresa can probably talk about this because you have to get this, you know, when you're hiring people, is that they need to be hopeful and persistent and want to work in the community. Because this is not an office-based model. So you got to get out there. And I always say, in hiring people, I can teach them how to do job development, but I can't teach somebody how to be compassionate and empathetic and caring. So it's kind of like you want to hire people with those characteristics.
And this is, the second bullet is why, I was originally thinking, oh, our VR staff could do it, but then I thought, I think our VR staff could go through the training,
Yeah,
but are they gonna be really able to be IPS specialists? Probably not,
yeah,
because they're so tied to aware and these data case management, they've got
Yeah.
and they're inputting so much stuff all the time. and
yeah.
So it'd probably have to be through contracting,
Right,
and maybe with DVR. I need to speak to the other leaders of the other.
right. I'm so curious who these people are when you bring it up.
Maybe? Is that possible? Are they here?
I don't know if they're,
Yeah, there are a lot of missing pieces.
but I can reach out to them.
Who is like at the state level, who within behavioral health, the mental health department would be a,
Marion Stucci's the head of adult mental health division, right?
She's like the deputy director.
And then there's someone, I know her, pretty well.
Of the Behavioral Health Administration.
oh, well, that'd be a good place. Yeah,
And then, the head of DED, Mary Brogan.
often within the Department of Behavioral Health at the state level, they have somebody identified as an employment person that's supposed to be in charge. They're often in charge of like housing, employment, and you don't have SOAR. I brought up SOAR before, but SOAR seems to be on their list.
I don't know too much about all parts of Department of Health. I'm looking at you. 'cause
Yeah,
maybe
I
you
don't
know.
think we have.
At one time, back in my days,
Yeah,
there was a person with away while I was there, I mean, yeah, working with him. He was in
I
our
know who you're
interview.
talking about. I
Yeah.
can picture his face.
But after that, I never, wasn't able to connect with anybody.
And that was in mental health, not vocation.
Right.
Oh, okay.
His name started
They passed away, and that was it, though. So,
with. And
Yeah,
then
that was like
just,
20 years ago.
it's just very siloed.
yeah,
We're just very siloed.
yeah.
I feel like there's a lot of disjointed efforts. Like everybody's doing their best, but if there was more collaboration, I feel like we could accomplish more.
Yeah,
There was also
Definitely.
a lot more staffing. And right now, I don't know what Department of Health, but DVR is like,
DE is,
yeah.
They're so short-handed.
Yeah.
There's
We've got,
units with like, the unit head has a caseload of 100, you know.
Oh, wow.
Yeah, so
we're like that too.
we have a hard time getting in touch with case managers.
So who did you mention? You mentioned somebody early on that you knew well, that worked at.
Marion Suji.
Yeah,
who is
that might be
Deputy
somebody to
Director,
start.
Department of Health.
Yeah, that may be someone to start with, and then find out if there's someone else. But it's interesting. We'll talk more about it. A lot of times, it's driven by VR, IPSs, and getting a hold and saying we want to serve more people with mental health conditions and help them get jobs. So you're going to want to hire a supervisor who values employment. Thank you, Teresa. We don't have many supervisors, and especially psychiatrists, that take the online course. You know, so the fact that she's getting into the weeds of it all is fantastic. It's amazing. Always track outcomes. I mean, we just feel like it's really important to be tracking outcomes so you can show people what works, you know, and have a story behind it. And then use fidelity as a roadmap. So you don't want to be implementing IPS without doing a fidelity review, so you understand whether you're doing it correctly or not. So this is what we were kind of talking about, but this is state level strategies. So state partnerships are really important, and that's often with our states, and I'll talk more about the IPS learning community, but part of that is that state leaders come together and sign a memorandum of understanding that they're going to work together in order to implement IPS. And that'd be state leaders within vocational rehabilitation and the Department of Behavioral Health. You want to have IPS trainers. So in all of our states that are part of the community, they have an identified trainer for the state that backs up fidelity reviews and make sure that, you know, we're collecting outcomes and they're on site, we hope, twice a month. I was also a state trainer in Oregon, and I loved it. It was like I'd do this road trip, and I drive down and hit Salem first, and I'd visit a program. They'd sit in on the team meeting. I'd sit on team meetings and go out and do job development and meet with leadership, and then I'd drive so far I'd stop at another site. So the trainers are on their side, and they'll say that. You're really here to be on my side. You're working with me. And you want to have that ongoing kind of like somebody behind you just backing you up. You need to have a funding plan. We were talking about measuring implementation to fidelity. So, you know, doing the implementation, but then what's helped me is I would go through and kind of look at sites as a state trainer, and I'd look across. So if there's an item like the employment specialist being dedicated to only employment, which is one of the items, because if you have an employment specialist that's also a case manager, what do you think happens to employment?
What happens to our VR counselors?
Yeah,
Yeah.
right. You know, it gets pushed to the back. There's other things that are more important. So one of the items is, you know, you have to be dedicated to employment 96% of the time. So I would look across and see this is item 3. And so I have a bunch of sites that are struggling with that. So that's where I'd know where to put a lot of extra support. I've said this enough, but outcome tracking is important. And we found that having IPS supervisor meetings. So a lot of places will get the supervisors all together so they meet and talk to each other as a group. They can share challenges and strategies. But let me back up a second. So how many, when you thought maybe at VR that the counselors could be the specialists, how many people do they have on a caseload, did you say?
Oh, I mean, it varies, but over 100.
Yeah, that's what I thought.
That's why I don't, as much as I would like it, and I would like to VR counselors to understand what it is,
Yeah.
It is.
Yeah,
I'm not I don't have the staffing to do it.
right. That's typically the thing that gets in the way. I mean, huge caseloads, whereas the specialist has 20 or fewer on their caseload. So,
Capacity constraints.
yeah, yeah. So mental health and VR partnership is a key. So we want to make sure that we understand that each partner brings something to the table. But I believe we're all trying to accomplish the same goal, right, which is helping people to get jobs. And I've already talked about this, that the VR counselors know about the types of jobs and careers. They know about secondary disabilities and chronic health conditions. And based on the individual's employment plan, they may be able to help with practical resources. So, a lot of that could be things to eliminate barriers to employment, transportation, eyeglasses, hearing aids. You could probably name a ton of other things. I mean, it's amazing.
Pretty much anything.
Yeah,
Pretty much anything.
if it's a barrier. I know, it's just amazing. It's amazing how helpful it is. And then the IPS specialists have their small caseload, so they can provide individualized side-by-side supports or services. And IPS participants are served by an integrated team. So it's an understanding, I think, from the VR side that these people are receiving all these services around them. It's not just about employment, but they're getting all their other mental health services. Are you getting into CCBHCs here at all? Are you hearing that word?
Maui is
You- You are?
No, I'm
What
not.
does it stand for?
It's Certified Community Health Center. Yeah, Certified Community Behavioral Health Center, CCBHC. And it's a really big deal that's crossing the nation. And it's like some mental health agencies become certified in it, and then they're also providing a lot of other medical interventions for people. They'll be checking for people's blood pressure and diabetes checks and things like that, and then referring them out to where they need to go. And you said that is happening here?
Yeah, after the Maui wildfires, I think they
Oh.
opened sooner than they were expected. But
Oh, and that's on Maui? Okay. Oh, great. Okay. IPS participants I already said that. IPS teams of VR counselors meet monthly. So this is a fidelity item, is that, bless you, is that the counselor meets, and sometimes we have a designated counselor, which is really nice, and other times there's a number. But you meet monthly face-to-face and talk about shared clients. So you're meeting to review, like, how is it going with this person? What services have they received? They help with, any kind of documentation that's necessary. And so it's kind of like, and here's somebody that's coming in possibly for VR, a potential referral. This is what's going on with them. So you're really coordinating the treatment again, all together to help the person. And this is the trainer oversight and function. So they assist agencies in making organizational and programmatic changes. And people think it's really easy, but you're really going in and trying to do organizational change, programmatic, and actually you need to shift the culture, because if you have a culture of people not believing that people can work, then that's something you need to work on. And so the IPS, the fidelity reviews occur every 6 months for agency. It's fair. There's 125 items on the scale. And if you rate 100 or lower, you're in the fair range or not. If you rate 100 to 114, you're in the good range. So once you hit that, then it becomes an annual review. But until then, it's every 6 months. And we just really find that it's like the first review, the baseline, is always the one that kind of is a aha moment. It's like, geez, we thought we knew it and we really don't. Or we thought we were doing it, we really aren't. So you get this report again, and it kind of tells recommendations for how to improve. And then typically what I find is the follow-up review, which is that 6 months to 1 year. There's like this monumental leap into the good range, typically, not always.
I'm so sorry, help me understand.
Okay.
Okay, so this state trainer is conducting these fidelity reviews, but is this as part of some federal regulation or some, what, the review is for who?
Well, the review is, so it's a part of implementation. So if somebody says, yes, we're going to implement IPS, typically then, and not always, often the state will say, or VR, like in Oregon, VR says, you're being a vendor, we need to know that you're at good fidelity. Because we don't want to pay for something if we don't know we're getting outcomes. And good fidelity results in good outcomes. So to be a vendor, we want you to have these fidelity reviews. And the state also backs it up.
So like it's part of the scope of work for the contract to go.
Right.
Okay.
Yeah. And then the trainer, and very often, you know, you may start with one trainer. I think we'll talk about this, but you've got to build the infrastructure because you can't. We started off, I think, with 4 sites in Oregon. I don't know, we might have 36 now. I think we're in every county. You know, when you look at Illinois, I think they have 120 IPS sites. So, you know, you have to have people that can be doing this, right? It's a lot. So, you know, the trainers also providing training and consultation to practitioners and agency leaders, and they work with the local state, VR state, to improve collaboration. So a lot of times it's like getting in there and trying to figure out like, how's it going? Are there bumps in the road? Or are we like, it's taking a long time to get people into eligibility, and meanwhile IPS is moving them ahead, so how can we speed up, expedite the procedure? You know, so you're working on a lot of those things together. And then you have participating in state and regional IPS leadership meetings. So like states have their own steering committees for IPS that work on, you know, things. For a long time we worked on benefits counseling because we didn't have many benefits counselors. So that was a problem we tackled. I think I already talked about this quite a bit. Okay. I think most of you, does everybody here know now, or should I, the fidelity scale? It's a tool to measure the level of implementation. So you know whether you're implementing it or not, whether you're off course. It defines all the critical ingredients. So when I talk about caseloads of 20 or only doing employment services or meeting with folk rehab, those are all items on the scale. And the part of the process is when you go to do a fidelity review, I'm interviewing practitioners, I interview the VR counselor, I interview a benefits specialist, I interview leadership, I interview family members, I go out and do job development with the employment specialist. So all those things are done over 2 days. And then there's this big report that's written for quality improvement. Okay. So this was, I had mentioned earlier, but this was the study that was done that helped with validating the scale. And we had people within our learning community, and I'll talk a little bit more about what that is. So we had people within the learning community that submitted their fidelity report, and we compared it to their quarterly outcome report. So we could measure what they rated on fidelity. So if you look at it, 7 sites rated in exemplary, so that's 115 and above. So that's really hard to get. And their outcome rates were 44%. So you can see when they're at good fidelity, which were 45 programs, theirs was 39%. So you can see how it goes down as their fidelity score went down. So we just know with higher fidelity, better outcomes. So this is an example. I don't know if you can see it though. This is an example of braided funding. And this is 2 states that really exist within the learning community. And this one, the Department of Mental Health, DHM. So this is mental health funding on this side. And it's SAMHSA, this state has SAMHSA block grant funds. They have an OBH contract directly with most of the community mental health centers. And they give each center, IPS center, $100,000 out of their block grant towards implementing IPS. So the sites each get $100,000, and then vocational rehabilitation pays by milestones. So there's job placement, which is $600, stability employed, $400, successful closures, $200, $300 a month for application status up to 2 months. It's kind of complicated, it goes on. But anyway, so the potential is $11,200.
Does it say which type of funding VR is using? Sorry, I can't see.
It doesn't say.
Employment funding?
Yeah.
Okay.
And this is another one. This is a different state. Their reimbursement is quite a bit lower. but they don't have the block grant, so they're using Medicaid, and they can only bill Medicaid under medically necessary services. So they have to tie back their employment services to their person's diagnosis. So if somebody has a psychotic symptoms or psychosis, then you're going to have to identify back why they need your assistance. So this person was the thinking is disorganized, they have trouble understanding interviews, therefore we're providing assistance, a mock job interviewing, and then you can bill Medicaid. You got to be really good at documenting it. And then they have a VR1 too here. This is the form that the programs in our learning community submit to us. We have an outcome portal where we collect outcomes from all the learning community states. And so we measure them. They can all see each other's. You can't see site level, but you can see state level, so you know how your state compares to other states. And they submit this on a quarterly basis, and this is it. I mean, so we try to make it one sheet, not too complicated, make it as easy as possible for people to submit data. And so that's really important. Okay. So the supervisor meetings, supervisors meet by state and basis to discuss trends and share challenges and brainstorm strategies. And I know in Kansas they used to meet, and the supervisors realized that they were having a lot of turnover, issues with retention. So it's like, what do you think? What do you think the reasons for this are? You know, is it because it's not a good job match? You know, is it not matching the person what the person really wants to do, so they leave their job? Is it because they're not getting enough job supports? You know, so they brainstormed. They came up with tools in order to learn how to better help people with retention. So it's important to have something like that in a state. So this is about the international learning community, and it's international. And so it's, to me, I love this part because it really and truly is a learning community in the spirit of it. I mean, people join and they really spend a lot of time helping each other out, thinking through how can we do better at what we're doing. So you're learning about strategies. We have phone calls on a bi-monthly call. It's international, so people call in from everywhere. And they call in and talk about research studies they're doing and different services that seem to be helping, so they're sharing information. There's occasions to participate in research studies, so sites that are part of the learning community are often the ones chosen to participate. So my one I'm doing, I told you about with corrections now and helping people with justice involvement, that's 3 sites in Oklahoma that are sites. There's one in South Carolina and one in Illinois. You know, so these are programs that are just chosen. And that's how we learn. We just continue to learn and learn and learn from these. I already said this, but programs share outcomes so all members can see the average employment rate and number of job starts. People will do that state-wise. In Oregon, we shared across with all their sites, we shared all their employment outcomes so people could see employment trends. So it's very transparent. Really believe in transparency. And members learn about new trends, expanding IPS to new populations, Medicaid for IPS and IPS and housing programs. So this is what it looked like in 2002. This was our learning community. And I think I was telling somebody it was like this vast void. It was kind of like, we're like the East Coast. And then there's Kansas and Oregon. So that's what it looked like at that time.
Islands.
Yep. And that's what it looks like now.
Whoa.
So I think we got 27 states and 3 districts because you have Alameda's County, California. Whew, that's a tough one.
Yeah.
I mean, every county is like its own state. I mean, it's very county run. So we have Alameda County, but it's starting to spread in California. We have Broward County in Florida, and then the District of Columbia. And then there's 7 countries that are involved. So New Zealand, France, Spain, the Netherlands, Italy. So all of these countries, Quebec, all of these countries are contributing. And they're all doing IPS the same way we would. They're all following Fidelity. So I actually had the great honor to work in Italy. And you know, I went there to help them out with Fidelity reviews. And they're doing IPS to Fidelity. It translates wherever you go. I mean, it translates to other countries. And they belong to the learning community, so they're joining our calls. They're all talking together. The Netherlands is doing a ton of research on substance use and employment. So, you know, everybody's working together, and it's just absolutely amazing.
すみません。日本どこですか? No,
I get found.
no, I'm saying that soon, maybe Japan.
Yeah.
Yeah.
Yes, of course.
You mean, I know, I was saying because we have a phone call next week
Oh, good.
with this, yeah. And there's, and Shatami, who's a friend of yours, and she comes to our learning community meeting. We have it every year. We have a learning community meeting in different states, and so they come in. It's just the most wonderful, and I'm kind of biased, but I love it because everybody's so excited. I mean, it's such a positive meeting where everybody's like so excited to share information, and
Maybe it'll be next.
yeah,
Yeah.
yeah, that would be wonderful. I'd love that. Thank you. I'm probably early again.